What do you say to the clinician that says, you know what, like, I'm not in the dementia space. Like, I don't really see old people. I'm in ortho, or I'm in GYN, or I'm in emergency medicine.
Yeah.
What do you say to that skeptic in terms of, being armoring yourself and preparing yourself for that patient or professional experience with the older adult person?
Well, here's the thing. In the world of dementia, 5 to 10% of us under the age of 65 are compromised cognitively. Now, the compromise most frequently is in the area of the frontal lobe or the temporal lobes. So, in other words, my ability to have executive control over my behavior or my ability to use language effectively to run my life or sequence and figure things out. So if you're in emergency care, the reality is you might run across me more than you think. And you may be thinking, oh, well, this is a concussion from having been an active sports person. And I would admonish you that you might want to look back on my history and see how many of these I've had, because you might also want to be asking questions of people who are around me and saying, have you noticed over time there's been some shifts and changes? Because chronic traumatic encephalopathy, frontal temporal dementia, are actually quite a risk factor for people who have head trauma that is not necessarily one that results in a coma, but instead results in impulsive behaviors or behaviors that lead to going too fast in a motor vehicle, making poor choices in relationships. And when that gets missed, there's a huge risk factor that it's going to end up with people ending up in legal situations or financial situations or stressful life situations, and families are compromised. So I'd encourage us to take a step back and get more curious rather than doing a quick fix on something that is in that moment what emergency